The global Mpox situation is becoming increasingly concerning, especially as it spreads across several countries in Africa. Singapore's Health Minister Ong Ye Kung recently highlighted that although the risk to Singapore remains low, the nation could potentially be among the first places outside Africa to encounter cases of Mpox due to its extensive flight connections. Speaking at an event organized by the Employment and Employability Institute in Sembawang, Ong Ye Kung emphasized that Singapore currently faces a low risk from Mpox because it does not have direct flight connections to the affected African countries. However, he warned that the virus could spread to the Middle East and Europe, regions to which Singapore has direct flights. This means Singapore must remain vigilant, as it might detect cases earlier than other regions due to its flight network. Ong stated that Singapore should be on alert and be prepared for the virus's potential arrival. While acknowledging the concern surrounding the global spread of Mpox, he underscored the importance of an appropriate and effective response if cases do emerge locally. The Ministry of Health, MOH, is focusing on several key factors when preparing to manage Mpox cases. Firstly, the fatality rates differ depending on the strain. The Clade 2 strain, which is currently more prevalent, has a relatively low fatality rate of 2 deaths per 1,000 infected individuals, approximately 0.2%. In contrast, the Clade I strain spreading in Africa has a significantly higher fatality rate of 3.5% to 4%. There's also the Clade IB strain with a fatality rate of around 0.7%. These statistics reflect the situation in Africa, where healthcare systems face numerous challenges. Ong expressed hope that Singapore, with its robust healthcare infrastructure, would be able to reduce the fatality rate even further if Mpox cases were to emerge. Ong also pointed out that the virus's spread in Africa has disproportionately affected children below 15, as they are not vaccinated against smallpox. This demographic trend is something Singapore needs to monitor closely. Moreover, while Clade 2 is primarily transmitted through high-risk sexual activities, Clade I can spread through close contact between individuals, although there is no evidence to suggest it spreads through airborne particles, unlike COVID-19. The Ministry of Health is monitoring the situation closely and has put measures in place to detect and manage Mpox cases. Local clinics are on the lookout for symptoms, which include high fever, skin rashes, severe headaches, and enlarged lymph nodes. Immigration officers are similarly vigilant with travelers. Should a case be detected, isolation and contact tracing measures will be promptly initiated. Despite these preparations, Ong reassured the public that there is no need to panic. People in Singapore are advised to go about their normal lives while staying aware and maintaining good health practices. Ong also urged anyone feeling unwell or showing symptoms such as rash and fever to seek medical attention immediately. To date, Singapore has reported 60 cases of Mpox since 2022, including 10 cases in 2024, all of which were the milder Clade 2 infections. Singapore's healthcare system is fully capable of diagnosing and managing Mpox, with comprehensive plans in place to isolate suspected Clade I cases and quarantine close contacts for up to 21 days. The World Health Organization, WHO, declared the Mpox outbreak a public health emergency of international concern on August 14. While Singapore's public health risk remains low, the MOH has advised all healthcare professionals and institutions to stay vigilant and has required travelers to report any symptoms or relevant travel history through the SG arrival card. Now, we want to hear from you. How do you feel about the potential risk of Mpox spreading to Singapore? Do you think the current measures are sufficient, or should there be additional precautions? Leave your thoughts in the comments below. And don't forget to like, share, and subscribe to our channel, 2230, for more detailed news updates.